Everyone. My name is Jason Joyce. I am the CEO of the ADAMHS Board of Cuyahoga County. Welcome to the 2027 RFP Bidders Conference. We also have Felicia Harrison, our Chief Financial Officer. There we go. And Colleen O'Malley, our Chief of Programs. So as far as sort of the Q&A session goes, there is a bubble down at the bottom of your screen marked Q&A. Within that, you can put your question into that chat. It'll be sent to Latoya, and she will go through those questions and then read them out to us as we go throughout this conference. First, though, we're going to start with the questions that were previously submitted through the RFP email. So I think we have like 11 or 12 of those that we're going to run through first. And then after that, we can start taking the live questions from the attendees. So let me pull up our RFP Q&A. This is here now, and we'll also post this on our RFP website. Can everybody see the screen? Felicia, Colleen, can you see the screen? Perfect. All right. So question one, are we submitting one budget for the total program request or two budgets? One for the ADAMHS Board funding and one for the state block grant pass-through dollars. So for this one, we're going to, you just have to submit one program proposal, one corresponding budget for the total amount requested. Applicants should focus on presenting the full program and its associated cost. So I know for some people, they have contracts through calendar year and then some through fiscal year, depending upon the funding. If it is one program, please just submit that as one program. We will then take a look at it when we look at sort of whether it will be funded through ADAMHS Board local funds or those state block grant dollars, or even possibly a combination of both. Question two, is there a cap on the number of providers or the total dollar amount that will be funded within a specific service category? So no, at this time, there are no predetermined caps on either the number of providers that may be funded or the total dollar amount allocated to any specific service category. Funding decisions will be made after all proposals are reviewed and will take into account the overall needs of the behavioral health system, proposal quality, available funding, and strategic priorities. So there is no cap and there is no issue in regards to the service categories. What is the reimbursement rate for a particular service? What if the rate does not cover my costs? For certain services, the ADAMHS Board has not established predefined reimbursement rates. So applicants are encouraged to propose competitive rates that reflect the cost of delivering those services. So an example might be housing. Please submit a competitive rate there, and then we will look at that as we review the RFP. For services that are also reimbursable through Medicaid, so think of your therapeutic services, your group counseling, your IOP, your TBS, your PSR, those services. ADAMHS funding generally will not exceed the applicable Medicaid reimbursement rates. Applicants should ensure that the proposed rates are reasonable, cost-effective, and aligned with prevailing reimbursement standards. Final rates are subject to negotiation and approval during the contracting process. So at least at this point, we will not likely be going above the Medicaid rates. So use those as sort of the basis for your proposals, if there is an applicable rate for that service. Prevention is one that I know might not have it, so we'll work more on that as you submit your competitive rates in the application. Question 4, which service category should my program be submitted under? Applicants should select the service category they believe best fits the proposed program. If ADAMHS determines during the review or contracting process that a different category is more appropriate, the program may be reassigned at that time. Because ADAMHS has not established predetermined funding amounts by category, selecting a category that is later changed will not place an applicant at a competitive disadvantage. Applicants should make their best effort to choose the most appropriate category. Please note that each program may only be submitted under one service category. So the vast majority of the questions were with this one right here. There was a lot of questions as to, which program do you think I should be in, which category? The general stance on that is, pick one and try to, do your best, is the short of it. If for some reason we believe sort of adamantly that it's another program, we'll just reassign it in terms of the contracting. The main purpose for those categories is that we intend to roll up reporting through those 12 categories to simplify the reporting structure and to have more of an apples to apples when it comes to our services in comparison between providers. So as of right now, at least for the RFP process, I would say just try your best in terms of the service category, but it won't, you'll be held harmless if it's in the wrong one, at least as we see it. How do I add additional rows to the budget template? So the budget template, there is no way to add additional rows to the budget template. That is protected. That's because we have links throughout that document. If additional rows were to be added, those links would be broken. So we don't allow the users to add additional rows. Applicants should use the existing rows provided in the template, and if necessary, combine similar expense items into broader categories. If additional explanation is needed, applicants may provide supplemental detail in the budget narrative portion of that document. Question 6, can you confirm that proposals are to be submitted electronically via email and that no hard copies are required? That is correct, no hard copies. Electronic is all we want. Question 7, can you provide a specific list of attachments and certifications required with the proposal submission, including audit materials and financial statements? At this time, ADAMHS has not established a prescriptive checklist of required attachments, as the appropriate documentation may vary depending upon the type of provider and the services being proposed. But we do have some examples here. So in general, applicants should submit materials that demonstrate the organization is appropriately licensed, financially stable, and operating in good standing. Examples of this supporting documentation may include your current license from ODBH, your current accreditation, CAR for Joint Commission, could be others. Those were just examples. So if you have others, that's fine too. Recent audited financial statements or other relevant financial documentation. Requirements for the audit may vary depending upon the size and the structure of the organization. So your audits might be different depending upon how big you are. If you are, one of the questions that we had in regards to this was if like a large hospital system, you don't need to send financial information for the whole hospital system. Just an overview of the specific program, and if there's any audits and or license associated with that program, that would be helpful. This section is not intended to serve as strictly pass-fail checklists in which the omission of a single document will automatically disqualify a proposal. Rather, ADAMHS will review the totality of the submitted materials to assess whether the applicant is a capable organization within the appropriate operational and financial infrastructure. So, yeah, that's pretty much the summary. Question 8, are training stipends for participants allowed under this service category? Yes, training stipends for participants are not prohibited. So we can take a look at them if there's a case to be made for that within your program. And may be included as part of the proposed budget. ADAMHS will evaluate the appropriateness of these costs as part of the overall proposal review and contracting process. Question 9, are for-profit organizations eligible to apply under the Class 2 RFP? Yes. For-profit organizations are eligible to apply under the Class 2 RFP. This eligibility applies only to Class 2 RFPs and does not apply to the larger general ADAMHS RFP unless specifically stated otherwise. All Class 2 proposals will be evaluated using the criteria outlined in that RFP. I know this was also mentioned in the separate Class 2 discussion, but we are just doing the Class 2 RFP for new programs. So just specific to that RFP, not the one that probably most of you are on here for. But that Class 2 RFP is just for new programs. So if you're a current provider, our current team will reach out to you and walk you through that process. But you will not have to do the RFP for Class 2s, which are effectively group homes, if you don't know what those are. Question 10, how should providers address concerns regarding the adequacy of reimbursement rates, administrative cost limitations, and the 90-day billing requirement? So providers are encouraged to submit rates in the proposals that they believe are reasonable and necessary to deliver services. So we are looking for competitive rates. That is why we are not setting rates, at least to start. The ADAMHS Day timely filing requirement will remain in effect. While this window may be shorter than those used by managed care organizations, ADAMHS generally maintains a more streamlined administrative process and does not impose as many of the additional requirements commonly associated with managed care, such as prior authorization, extensive utilization controls, and frequent recruitments. So we do believe that, in effect, we have one strong rule, the 90-day rule, and that is kept in place because in absence of that, since we are budgeted year over year, we don't have a multi-year budget. We can't go further than 90 days. If ever we were to get a multi-year budget, or at least more support sort of over the year, and more guarantees as to where our state, federal, and local funding will come from over a multi-year process, we would certainly then look at extending that timeline. But in absence of that, that timeline will likely stay into place for the foreseeable future. Alicia, anything else to add on that one? I'll take that as a no. Question 11. The standard budget template does not fit well for the treatment services funded with non-Medicaid dollars. How should these requests be submitted? Yes, after looking at it, that is a valid request, and it's something that we have worked on. So ADAMHS will provide an additional template specifically for treatment services funded with non-Medicaid dollars. This template will allow applicants to present projected service utilization and the funding requested. So it's going to be a pretty simple document, so nothing you have to worry too much about. So the service, the code, the unit, the rate, the quantity, and the total dollar amount, that'll be posted on the RFP website as a supplemental. So if awarded, providers will not be held to the exact service level quantities included in the template. So what you put in there is to be sort of a projection to give us an idea of what your thought is on the requested funding amount needed for your non-Medicaid, or what we used to call sort of in the past, the pooled dollars. But if, for example, if you put, we're going to do 100 units of IOP, we expect that we're going to have 100 units of non-Medicaid sort of IOP and 20 units of counseling. It's not as if you do 25 units of counseling and only 80 units of IOP that you have to, we're just looking at the total dollar amount, and that's going to be the pool or the bucket that you can pull from for your individual agency. Very similar if you have a contract currently to what we do now. There'll likely be more included in GOSH, since that's part of our larger sort of strategic initiative of expanding a general understanding of where our services are. So there's that piece. So there might be sort of more incorporated in GOSH, but it will be fairly similar to the current setup. Instead, the approved amount will be function as a funding pool from which eligible claims may be submitted and reimbursed through GOSH, subject to applicable contract terms and requirements. I do believe that everyone or mostly everyone, I think maybe there might have been one or two that we held off for the bidders conference, but I think almost everyone got a response back if they asked the question, and or the response is here, and that will be posted on our official website, should take all the pre-questions sort of off the table. But I'm guessing, LaToya, you probably had some questions come in as I was speaking.
Yes.
So I'll turn it over to you to ask, and we'll do our best to answer.
Okay. So we have several questions. Some of them you have answered in your responses, but I'll just go ahead and read them out just so they're acknowledged.
Great.
This question is from Leslie Seiger. How is the application submitted? Is it hard copy? How many copies do you require? Where would it be sent?
Correct. Yeah. So that's all in sort of the RFP. It's all digital. Hard copies are not required, and the email is also listed in the RFP draft as to where to send them to.
Okay. The next question is from Unique Grove. How are new organizations scored when leadership has the experience, but the entity itself is new?
I would say that there's not going to be sort of points against them if they're new. Obviously, we're going through this whole process and doing this work because we want, new programs, new ideas, new proposals. So, but it would be incumbent upon them to explain, how they've done the service, how effective they were in those things historically. But yeah, I mean, there wouldn't be anything held against them in terms of scoring that if they weren't a provider before.
Okay. The next question is actually from an anonymous attendee. This person wants to know, can we submit our budgets using a different template that contains the same level of detail as the RFP template? We already have standard budget templates that we use for our board. Putting numbers into a different template is possible, but would be quite time consuming.
The answer to that is no. No, it's the RFP template that they have to use. So certainly, understand sort of the time and nature of it. But as far as sort of streamlining in what we need and sort of the consistency in our review process, we would need it in that document.
Next question is from Leslie Seeger again. Do you want the application documents merged into a single document, or can we submit the attachments as separate documents?
In an ideal situation, they're merged into one. And that's usually done by, by a fillable or a searchable PDF was the requirement. We would not, if somebody had additional attachments as part of their application, as long as they were submitted all at the same time, there would be no penalty for having sort of those attachments. Some might not copy over, things like that. So we're open to that. But they would all need to be submitted within the same email. And as long as they were the standard ones that we're requesting, so either in a PDF form or a searchable PDF, not scanned into not print something and scan it, searchable PDF or a Word document.
Okay. The next question is from Larry Heller. He would like to know if there are any specific set-aside categories. So for example, under the SOS, there may be several special funds which are separate, but are applied for within the SOS application.
There are programs that we have already set aside. The list of those programs have been listed on our website. As that giant horn is in the background, so my apologies about that. So yeah, so those would be the programs set aside, but and Felicia, correct me if I'm wrong, I don't believe we have any SOS funding, at least directly through the board, that we're assigning right now. Is that correct?
Right now, we have one SOS award that's getting ready to end. So there's nothing that's carrying over into next year.
Thank you. So there are some set aside, but not program categories, specific programs that are set aside that are listed on the website.
Okay. The next question is from Darlene Darby Baldwin. She says, my agency was cut 20%. Must I use my current funded amount as a benchmark for our presenting 2027 funding request?
No. I mean, what I've talked about before, I know that, I think that we're all in agreement on here is that, in an ideal situation, we would have been more strategic, with those reductions, but with the timing, it had to be done, I think, within 10 days. And within 10 days, you can't run sort of a full scale sort of RFP to decide, which providers should have a cut and which ones shouldn't. So we are using sort of this RFP process as a reset. So no, it would not be a requirement to have the reduction of what you did, 20% now or what you needed in the past. I would say submit for what your program proposal is and what you're looking for. I always say within reason. So, we don't have program categories assigned, but, we have, Felicia, what our total pool of everything would be around 67 million projected for next year.
That's correct. Yes.
So if you send a proposal for 30 million, that's probably not going to go through, seeing that, that's, a little under half. So I'd say within sort of the scope of where you think things might be, but there's no requirement for the 20% to not be in there. You can put it in there.
Okay, the next question is from Maddie Moser. Maddie would like to know, Our program is currently being operated through a fiscal agent that is neither for-profit nor a 501c3. They are a regional arm of a state agency and are tax exempt. Should we apply with the Class 2 RFP or the nonprofit RFP?
If they are a nonprofit, that would be fine. If they are a government agency, that would be fine as well, if they're a county. If they're not sort of focused within Cuyahoga County, they would need not apply for that. We're not going to fund things outside of the county. But yeah, we're looking for nonprofits for this one. So if it is a for-profit, meaning that, there's somebody who gets that money, or the more that you make in terms of margin, the more that goes to one individual or a group of individuals. Then we're not looking for that sort of in this go around here. We are looking for things that are classified as nonprofits or government.
So can I just add,
Please.
so they were asking, should we apply under the Class 2 or the nonprofit RFP? You would only apply under the Class 2 if you are a licensed Class 2 facility.
Thank you, Felicia.
So,
Yeah, that's a
yeah,
good point.
only if you're a licensed Class 2 facility would you apply to that RFP.
The next question is from Gwen Koenig. To clarify, was it stated that for-profit entities are only eligible to apply for group home services?
So there's two caveats to that. So one, if you are a current ADAMHS Board, if you're currently funded by the ADAMHS Board, you may apply whether you are a nonprofit or a for-profit. If you do not have or have not had a contract with the ADAMHS Board, then you cannot. We're not looking for for-profits in this go-around that have not had a contract with the ADAMHS Board, with the exception if you are a Class 2 provider. Since, at least within that spectrum, there's very few, if any, nonprofits that are in that space. So that's the one carve out that we made, I guess specifically two carve outs. If you already have a contract with us right now, you can apply whether you're a for-profit or nonprofit. But other than that, at least this go around, we are specifically looking for new nonprofits with this RFP. If for some reason we are unable to find the available services through this RFP, we will submit again for profits. And we think with the July and September timing of the first announcements, that we will have plenty of time to make that consideration.
Okay. The next question is from Joyce NG. Not sure how to pronounce that. Could you please clarify what is meant by need and alignment with Cuyahoga County priorities, which is listed under specific program, under program-specific responses? The county has multiple strategic plans, so is there one in particular that you are referring to with this question?
So we're referring to the three documents, I believe it's three, and LaToya, correct me if I'm wrong on this, that we've attached to the RFP website. So I think it's our HMA document. There's also, I think, our strategic plan, and I believe maybe a third document.
Our needs assessment. So it's an optimization study, our needs assessment, and the strategic priorities.
So those are the three documents. They do have multiple recommendations, as you mentioned in there, but those are the three documents that we're using to judge sort of against that standard. So those would be the three documents I would guide someone to see if they align either in part or in totality with those.
Okay. The next question is from Unique Grove. Unique is asking, can a nonprofit with a pending or recently approved 501c3 apply? Will new organizations that are not yet operational be considered if they will be ready before January 1st of 2027? So she has two questions.
Yes. So yes, they will be considered if they do sort of make it through that sort of round where we're like, hey, this looks like the appropriate program and this is something we want to do, then we'll have to navigate sort of that piece when it comes to the contract. Likely, if we do cut a contract, it will be dependent upon that nonprofit status sort of being ready to roll. So, but yes, if you do anticipate it, just make sure that's documented throughout and sort of your process and how you're going to obtain that. But that would be fine. You do not have to have official nonprofit status nor a license in what you do currently. But if you don't, you'll have to document how that'll be in place and ready by the time contracting and the agreement starts.
Okay. The next question is from Cynthia Rios. My question is regarding 1.4.4 housing services. Does the individual need to have mental health and substance use needs? Can it be mental health only?
Yes. Yeah. It can be substance use only too.
Okay. Next question is from Doreen Mittinger. Can you please explain the last attachment to the RFP document labeled treatment services in the 2027 RFP?
Yeah.
Is there a required format for responding to this page? And that was, I think, what we just added to the site.
Correct. So treatment services will in effect be, since it's been changed sort of after the first RFP, but it will be an additional program that you can put in there for. And within that, the budget does not, the current budget form does not really line up well with what we've done with that in the past. And that is for those non-Medicaid dollars. So for people that don't have insurance. And being able to provide those treatment services for people that don't have insurance if they're a Cuyahoga County resident. So what would typically happen there is if you've already had a contract with us, but I'll explain it for those that might not. Within that, you would put in sort of the service, the code, the rate, which will be the Medicaid rate. So just use the behavioral health workbook on the Medicaid website. In what services you plan on providing, and at least an estimated volume of what those services might be. Again, not holding you to that number, but we're going to use that as sort of an estimate of where we think it might be. Now, for agencies that we've already worked with, we do have at least some historical data. For ones that we haven't, we'll have to take into account, that review. But yeah, that's what that's for. And basically, after the fact, at first we thought it would be best just to incorporate sort of those services into individual program, but that would have been too complex. If we said like, hey, just put your non-Medicaid in outpatient and put your non-Medicaid in housing and sort of those things. So we thought that separating it out would be best. So those are additional non-Medicaid hold funding dollars, if you will, that will come from that bucket.
Then she said, is there a required format for responding to the page?
Yes, so that required format will be uploaded to the site, I believe today, right, Latoya, or will be tomorrow?
Yes, it's up there now.
Oh, it's up there now, even better. So yeah, so there's an additional spreadsheet. You can use sort of the budget narrative that we already have. And anything that's applicable. If it's not, just leave that budget narrative part blank and then use this additional one for the treatment services, and only for the treatment services. You don't have to do this for anything else. Treatment services, for those uninitiated, so it's a special category where we look at funding set aside and available for people that don't have insurance. And within that, we ask people to estimate how much they'll utilize a particular service and what they need it for. And then we set that dollar amount aside for that agency so they can draw that down over the year. So for newer agencies, what we'll do is we'll look at, I guess, as best we can, similar size, similar agencies and what maybe they've had in the past. Would that be fair to say, Felicia, in terms of estimates for that as we look to see if they're valid?
Yes.
Yeah.
And just for people who aren't sure, so treatment services when we're talking about treatment services, we're talking about named Medicaid services such as psychotherapy, case management, TBS. Jason went over a few other ones, but when we're talking about that treatment services program, those are the services that we're talking about.
Yeah, so for agencies, historically, that for agencies that have had contract with the ADAMHS Board, not all, but I think a good portion of them, if they provide those Medicaid services, they also sort of have a funding amount specific for people that are Cuyahoga County residents that don't have insurance that show up at their doors, and then we help pay for them without insurance to fill the gap until they're able to get on Medicaid, or if they're unable to, as they go through their behavioral health crisis.
Okay. The next question, I believe you answered this earlier. Anonymous attendee. If a for-profit organization is currently contracted with the ADAMHS Board, is the for-profit organization eligible for grant funding, not the group home funding?
Yes.
Next question is from another anonymous attendee. Do you have an IDC cap policy or link identifying that on your website?
No, I'd say that's something we might have to look at. I know that's typically on the state grants, they have those, so I'll have to look into that piece. But no, I don't think that's something we've done before. But I can look to see if it's something that's applicable.
The next question is from Brittany Schartz. If we are doing treatment services, do we use both templates or just the new one that will be uploaded?
The requirement would be the new one. You can use sort of the old one too if there's space that you want to have sort of an applicable budget narrative piece or talk about sort of your staffing or what that might look like. But the core one that we'll need would be sort of the estimate on the utilization and what services you plan on doing for us to get a ballpark of what we might need to set aside for your agency. So the only one that I think we'll really need would be the new treatment services one. But for some people, I know they like the budget narrative piece or adding sort of additional elements in. You can use that if you'd like.
Okay, the next question is from anonymous attendee. We are a nonprofit that is funded by our for-profit sister company that mainly offers services for mental health illnesses. Would our nonprofit company still be eligible to submit a proposal?
If you're a nonprofit, you're eligible to submit. Now, in terms of sort of structure and sort of all that stuff, we're just looking at that if you're a nonprofit and you can show that you're a nonprofit and that your services would be billed and submitted under said nonprofit. But we don't have the I would say I don't have sort of the complex sort of sort of the subsidiaries and org structures and those things. But if you can show that you're a nonprofit and the funding will be going to a nonprofit and you got a 990 and sort of all that stuff, then you're in good shape.
The next question is from Rebecca Thabala. Will we receive a confirmation email that our submission has been received?
It's a good question. I'd have to defer to our technical team. Do we know if we have a on the RFP currently? Does it say that do you get an auto sort of response that the email's been submitted, or do we need to set that up?
I think we'd probably have to set that up.
All right. So I think that's something we'll aim for then. As long as we can technically do it, we'll add that. I think that's a nice add. So thank you to whoever brought that one up. Because inevitably, then there'll be another email that says, "Did you get it?" So I get it. I'm be told the same thing. I want confirmation it was submitted too.
It would be an email, so they can also do like a read receipt. That would confirm that it's been received.
Yeah, let's try to get the auto on there though. I think that'll be the most seamless for everybody, so they can have that confidence and have that timestamp and all that stuff. Yeah.
It looks like there are some proposal sections, like section 6, program specific response, that does not have a scoring rubric attached to it. How do you intend to score the application?
So the application sort of outlined our, 12 categories, if I'm not mistaken, off the top of my head. So we're going to score it like that. But that's just the first step. So individually, everyone will score it sort of within the given review team. And then that review team will sit down and discuss and commence and sort of review all of them together. So the decision will be made not entirely based upon an individualized score, but with that score then brought to the review team and the review team sort of reviewing everything in totality and sort of hashing it out. So it's going to be a group effort to decide it. So no one person or one score will either raise up a proposal or sink a proposal.
Okay, the next question is from Angel Chapin.
Mhm.
Are there limits to the amounts of different services that can be provided in the same program? For example, TBS, pharmacological management, and counseling all in one program.
It doesn't make it as clean. I certainly understand how some programs might be that way, and if that's how your program is, we can do our best to try to, have it in that piece. But I'd say I would try to separate those out because even if you submit it for the RFP, there's not going to be likely a scenario where we fund things sort of in this huge bucket, sort of moving forward, because we want to compare apples to apples. So if you have a farm management program, that's a farm management program. So I would say that's something that you're going to be reporting on when it comes to farm management, psychiatry, sort of those things. That's going to be separate from TBS. The reports and the comparison between TBS programs are not going to be the same as the reports and comparisons between farm management. So just something to keep in mind. Again, it's best to kind of separate those into the blocks that we have because that's ultimately how it's going to be separated when it comes to reporting. But how you submit it, at least to start, will only be the first step sort of in that process. But my suggestion would be to try to separate those. Not I got a housing, farm management, TBS group counseling program. Separating those out to the buckets that we have, since that'll likely be what happens with the reporting structure moving forward. And that's part, I'll just say a quick side note. So that's part of the struggle that we have now, right? So there's these things that are, called programs, but they have so many different sort of things in there, and there's no way to differentiate or sort of have apples to apples between them. How do we know one farm management program's doing well when, that's buried in sort of this other program and that stuff. So that's what we're going to try to piece apart so that the reporting program is simpler and we have better data in regards to comparison between programs.
Okay, the next question is from Larry Heller. Is there any total page limit if one agency seeks funding for multiple programs? Will there be enough space to justify each program?
So there are page limits per program. I believe we set it at 4, and there are page limits for the total number of programs that you can submit for, and I believe it's 30. So you do have to operate within those restrictions. That's just for the program section. So as far as the other sections go and additional attachments, there is no page limit on those.
Okay. The next question is from anonymous attendee. My organization wants to seek funding for our IOP, specifically to cover the cost for clients we accept who are not covered through private insurance or Medicare, Medicaid.
Mm-hmm.
How should we present that in the budget?
That's a great question. And that speaks to what we were talking about earlier with that treatment services piece. So you would, fill out sort of all the categories as described in sort of the RFP. And then the program would be treatment services. And you can list within there IOP as one of the services that you are requesting non-Medicaid dollars for. Within that treatment services, you could also put individual counseling, case management, whatever it might be. But you can submit that all under there. If you're just requesting non-Medicaid dollars for us to pay for Medicaid billable services, or services that have a code for Medicaid is maybe a better way to say that. then you can just do that through treatment services and be done with that piece. You wouldn't have to make each one for each service, just put them in there, and but that's only for just those dollars that are set aside for those services.
Okay. The next question is from anonymous attendee. We are a nonprofit located in Summit County offering free mental health screenings. Would we qualify, or is it only for Cuyahoga County organizations?
It's not necessarily for Cuyahoga County organizations. Your headquarters could be outside of Cuyahoga County, but you do have to render services within Cuyahoga County. So if the question is people from Cuyahoga would drive to Summit for said service, the answer to that would be no. No, that would not be something that we're looking for.
What documents specifically should, oh, this is anonymous again. What documents specifically should we review in order to determine alignment with the identified behavioral health needs and priorities of Cuyahoga County as the RFP states? I think we.
So LaToya, could you name those three again that we posted on our website?
Sure. The community needs assessment, the provider network optimization study, and the strategic priorities. Those are all on the RFP landing page right below the image.
Thank you.
The next question is from Karen Snyder. Do you have an estimate of the amount of funding we can apply for?
The total amount is 67 million, Alicia?
Yes, correct.
So something less than 67 million, but keep in mind that there's at least 127 attendees on this call. It's going to be competitive. There's going to be quite a bit. I would say as of right now, I do not believe we have a single entity, even our largest entities. I don't believe there's anything over 3 million, if I'm not mistaken. Likely our largest contract for this calendar year will be the Crisis Center, which is a big endeavor for us, and that is at 4.5 million. Gives you an idea of sort of what sort of the largest providers that we have right now in terms of ADAMHS Board contracting are, and sort of what we anticipate to be our largest program support for the next calendar year. Would that be fair to say, Felicia, as far as budget stuff goes?
Yes, yes.
Okay.
So just, to speak sort of on extremes, right? So it's highly unlikely that there'll be a $5 million award or $6 million award to one entity, or a $10 million award to one entity. So I would say if you're thinking about that, probably low likelihood that will occur.
The next question is from Doreen Mittinger. Would the board support paying for products or services that are not covered by Medicaid or GOSH, such as bus tickets or GED classes?
We have paid for services like that before, so it's something that we would consider. I would say we have gotten out of that space less so as of late because of the potential issues sort of associated with that. And or at least Medicaid wise, the requirement by the managed care organizations to facilitate transportation. I'm not saying we're going to get out of that space entirely. Obviously, we have transportation in there. We want to, continue to look at that. But I would say, as far as our initial scope and the recommendations sort of from HMA and those internal documents, is to not build out sort of large scale sort of, gift cards or things like that. I would say that would probably be we could look at any program you submit, but I would say that's probably, at least from our priorities and internal documents, a lower likelihood to support. Colleen, would that be fair as far as priorities go?
Yes. Some of the programs, they do have transportation needs for certain reasons, and then they would build those in, but to just fund just transportation, we would.
The next question is from Doreen Mittinger. We have been receiving benefits under 2 separate grants. Can we combine them into one program?
Felicia, you probably know more about this than I would, at least specific to Dory's question. What are your thoughts on that?
Yes, you could combine them into one program, especially like ease of service, ease of submitting documents to us. That's fine.
The next question is from Darlene Darby Baldwin. Because funds will be paid through RAP funds for Class 2 facilities, is it correct that budgets submitted should not exceed $1,600 per bed or $8,000 per month?
So yes, we have not increased the amount that we're considering for RAP payments, so it would still align with state RSS funds, which is $1,600 per person. So we will still be in alignment with RSS funding from the state.
Okay, the next question is from an anonymous attendee. We are going through the CARF accreditation process for an existing SUD/mental health agency, and we'll be opening a new LOC by the end of the year. We see the proposals are due for 2027. If the LOC is not open/accredited, but in process and applied for with CARF, will the new LOC qualify for funding?
So when they're saying LOC or LLC, what?
LOC.
So level of care, I'm guessing is what that means. But short answer would be ultimately what you're going to need the most is a license from the state. As of right now, at least for most, if not all, mental health and substance use community behavioral health facilities, they are requiring some sort of national certification to kind of transfer that over. I know there might be some that don't have that, and maybe there's other ways to get around it. The license is going to be the biggest thing. If you don't have the license to do what you're asking, we would not be able to fund it. As far as sort of CARF and Joint Commission, those strengthen sort of the proposal. Those also will reduce our burden in terms of oversight as we look to streamline our review process to those that have national certifications and reducing sort of the amount of audits and reviews that we do for those programs. So it is a value add to have that, but the license would be the biggest.
Okay, the next question is from anonymous attendee again. When you reference ineligible for Medicaid, are you including people with Medicare and commercial insurance that do not pay for services like TBS?
Historically, I don't know what we've done with that, Felicia. Do you know? I would, if somebody's underinsured but they have private insurance, I know historically that's not something we prioritized. Now, is it something that would be excluded within the rules? I don't think it's excluded.
No, there are times like if it's that the person is underinsured, we have paid for some services. So say if you have Medicare and Medicare doesn't pay for XYZ. As long as we can verify that whatever insurance that you have, whether it's Medicare or some other commercial insurance, doesn't cover the service in particular, then we could make payment on that service, but we would have to have something to verify what services are covered and what services are not covered by that private insurance.
And not covered is different than denied, right?
Correct.
So
if it's denied, if it's denied, then we wouldn't cover it. If it's a service that's not covered, period, then we would consider covering that.
Yeah. So, for example, I know that Medicaid just sent out a memo yesterday in regards to caps and limits. So, if those services were denied, it's not as if you could just tap right into the ADAMHS Board to keep billing sort of those. They're putting those terms and restrictions in there in that process in place. So that skipping out on that process of applying would not you could just bill the ADAMHS Board for that. That's something we would be looking at.
Okay, the next question is from another anonymous attendee. Would the board support paying for products or services that Medicaid or GOSH does not cover, such as sober housing and bus tickets?
Well, as far as sort of quote unquote sober housing, so with the passage of House Bill 33, they are mandating in those rules, and our team has been following it, that if you're providing sober housing, you're providing recovery housing. If you're providing recovery housing, then you need to be certified a level 1, 2, or 3 recovery house. In the state of Ohio, they don't do level 4 recovery houses. That translates into a level 3.1 residential. So you could be correspondingly licensed with that, and we can take a look at that piece. But there is no longer, per the rules, sort of these generic sort of sober house or things like that. If you do that service, you have to be registered and credentialed with Ohio Recovery Housing or on a path for that. And I do believe that is illegal at this point to do that. They could come after you for that. So if it's Ohio Recovery Housing, yes, that's something we want to look at. If it's sort of a generic sort of sober housing, that's a way to get around that requirement. That is something we will not be looking at because we're not allowed to do that. Technically, any licensed agency is not allowed to refer to housing that's not Ohio Recovery Housing certified. So we'd be following those rules from House Bill 33.
Okay, the next question is from anonymous attendee. Please, can you provide more detailed written guidance on treatment services for organizations who want to submit in that category and who have not received it in the past?
Yeah, we can look at adding that to the website. I know we've added that already in terms of a description, but we can take a look at it again, and if it's not as thorough enough, we might be able to tweak it. But before we do that, I'd say make sure you've read. So some of the questions that have been asked today are in the RFP, which is written plain as day, right? So make sure you read the entire RFP first, one, and then two, make sure that you read sort of the RFP page. And if you do those two things and you still have sort of follow-up questions, let us know. But we do think that it's fairly clear, but we can take a look at it one more time to make sure if we need to add any sort of more detail to it.
Great. Next question, and the next few questions will be from anonymous. How many entities?
We can just, Latoya, for time's sake, you don't even have to say.
Don't even say
have to say anonymous. You can just ask the question.
All right. How many entities are receiving funded contracts currently?
Well, we have 69, right? 69 or 70 providers or so, and then around 200 or so programs, if I'm not mistaken.
That's roughly, yes.
Yes. So that's the ballpark of where it's at right now.
We are a nonprofit that does not offer mental health services, as what I'm seeing in the questions. However, we provide monthly mental health programming, such as art therapy, as well as monthly programming that supports social, emotional wellness for our clients and volunteers. Is this program a fit for this grant opportunity?
Yes. Yeah. You could submit it under, I don't have the categories pulled up, but that you would be able to apply for additional services like that. Could be under what? Recovery services. I'm probably forgetting another one, but yes.
Treatment services.
Treatment services too could be another one. Yeah. Thank you, Colleen.
Thank you for responding to my previous question, and I am sending this again here to confirm my understanding. We are a local nonprofit located in Summit County, offering free mental health screenings and memory loss screenings, and we also offer free transportation to folks within a 150-mile radius, including community members from Cuyahoga County. Our proposal might be looking into a small amount of up to $50,000. My understanding is that since folks have to come to Summit County for services, we may not be eligible for the application. Can you please confirm?
So if they're transporting, I don't know, what do you think, Felicia? It's sort of a gray area. I don't know if we walk through all that in its entirety.
It's sort of a gray area. Usually, I mean, first of all, it has to be a Cuyahoga County resident. Typically, we fund services for locations within Cuyahoga County. As Jason indicated before, like the parent company may not be in Cuyahoga County, but there should be a location in Cuyahoga County because we do have to think about access for everyone else within the county to, you know, access these services.
Yeah, short answer would be a gray area. I mean, you could submit it. I guess we can consider it since I would say at this point, there's probably not a definitive answer on that one. But it would probably be a better fit for Summit County residents because there would be associated barriers with the program, including transportation and location and not, accessible throughout the vast majority of Cuyahoga County without a significant drive. But I would say, Colleen, Felicia, we're in agreement that it's a gray area and it probably wouldn't be anything we'd strike right now. We could take a look at it if they wanted
I
to
would
submit.
think, and I mean, we're looking at populations that are underserved and that there's access. So unless you could really support what that population is and why this is reasonable access, otherwise it would be difficult.
Yeah, I think that's fair.
Can you please clarify transportation/bus tickets/GED class registration fees question, specifically as it relates to recovery support services? Not sure I understand that question.
I could try to explain it a little bit more. So, right now, we do pay for bus passes at sort of facilities, right? And we have not all, but for some that have contracted. We also have sort of specialized contracts for transportation with some facilities that transport for specific programs or like crisis services or to get people in quicker. So that's something that we would certainly consider in the future as well. But it's usually tied to some sort of wraparound support or a way to remove barriers for a specific population that we're looking to target. Not just like, hey, we're going to be a free bus pass program, right? So that would be a low likelihood of probably getting passed through our sort of screening process. But an example could be that we're targeting sort of a specific neighborhood within Cleveland, and our location is there. Residents within that community struggle to get there because there's a low number of residents that have cars, and the bus routes are not great, and they actually have to reroute to Tower City, so it's an hour sort of just to get there, even though they're only a couple miles away. So this is what we would factor in, say, with a Lyft or a Uber Health transportation proposal. That's something we would consider. That would probably be a strong proposal for transportation. So hopefully that provides a little more clarity as to what we're funding now and maybe some of the ways why we would look at one and not another.
Are all currently funded entities nonprofits?
No, I believe we have one or two.
One or two.
Yeah.
If our nonprofit has funding through June 30th of next year for several team members, can we apply for half-year funding for those team members that would start paying out in July of 2027, aside from other program pieces that begin in January of 2027?
So they have a contract with us through June of 27 right now. So that contract, we haven't received the funding yet, so we can't guarantee it, but it will likely continue and get passed, in the next couple weeks, and then continue through June of 27. So you'll be applying for that program, or if that's like a piece of what's funded out of like a larger program, you'll be applying for the program in it itself, like we mentioned in the earlier question, that just submit it on behalf of programs and we can kind of figure out the funding piece. So yes, you can submit for the program now, and we can take a look at it. But you'll need to submit for the program through this RFP anyway, because the start times on funding for this RFP are either going to be January of 27 or July 1st of 27, depending upon the funding bucket. The vast majority of the contracts will be January 1, because that's by far the largest bucket of funding that we have. But there will be some that start July 1st as well, of 27. So shorter answer is yes, apply. And apply based upon sort of the programs and sort of make the case for the program. And then in terms of funding, we can figure that out as we move through the process.
Okay. The next question is, are peer support services considered treatment services and included in that program, or as recovery services, as in a separate program?
It probably depends upon the program. I would say for the most part, it would probably be under treatment, since it is a Medicaid funded service. Now, if you were doing something different, whereas maybe it's not Medicaid funded, or there's exclusions in terms of the Medicaid funding there, then maybe recovery support services would be better. But I'd say for the vast majority, it'd probably be under the treatment bucket.
Next question. The program we are submitting a budget for will include largely Medicaid billed services. We would be requesting funding for components that are not billable to Medicaid. What is the recommended approach for RFP completion?
So that would be to separate your programs based upon our categories, and then build out within there the additional services that are not Medicaid funded, or the people that are not Medicaid funded, or the whatever you do, I guess, within those programs, it's not Medicaid funded. But I'd say try to break it down by our service categories, because that's how reporting is going to go within those categories if you're selected. And then within there, just make the case as to why you need those additional dollars to help support your program, and why Medicaid in and of itself is not enough to cover said services.
Okay, and this appears to be the last question. If our proposal does not get funded, would we be informed as to why, to offer us a learning moment?
Potentially. With the volume that we have, that's probably going to be dependent upon how many people apply and sort of the process for that. So that's a potential. But I would say we have not committed to individualized sort of feedback for each proposal as of yet. But we are open to the thought of that. And I would say, if after everything's all done, if there was people that wanted to look at and schedule meetings to kind of review the process, I'd be open to that as well. But I would say at this point, it's probably unlikely that there's going to be individualized sort of responses back to every program that's submitted, since I do imagine a large number of programs will be submitted for this RFP.
That was the last question.
All right. Well, look at that. Right at an hour too. We're doing good today. So thank you to everyone who attended. If you're watching this recorded, thank you for making it this far. And I'll just pause for a second to see if there's anything more before we close. All right. Well, enjoy your day, everyone. Thank you for attending and for listening. Bye.